Good morning, it's Carrie Scroggins. Today's Thursday and it's September the 30th. I hope this video finds you having a great week. I wanted to talk to you a little bit today about the comments that I've been seeing and the questions that I've been seeing on several of the RSD websites from new patients who are exploring different type of options for their chronic pain. And so I wanted to just kind of give you a little bit of a background, and I hope this can help you to make a decision that you might be currently contemplating if you are a patient of RSD or CPRS. Back in 2006 is when my injury took place. I actually fell in the city of Phoenix into what at the time was the light rail system that they were building. And I had a pretty significant injury. My left ankle, all of the soft tissues basically exploded in my ankle, and it was very painful. The RSD came on pretty quickly, within about 6 weeks or so. And when we got to the point where we needed to operate on my foot, the surgeons were fearful to operate because of this RSD that they were fearful that I had. I had all the symptoms: the burning, the pain, the pins and needles, the significant color discoloration in the foot, the massive swelling, the temperature differences. I had just about every symptom that you could have with this disease. And so unfortunately for me, my surgery took almost 6 months to complete. And during that time, I was in a walking boot. And since then, I have found out that that probably was not the greatest thing to happen, and it actually caused me more problems than it did help me. So when I got around to having the surgery done, it was in November. It was actually Thanksgiving. And in that time period from April to November, I was living on oral pain medication, and I hated it, every moment of it. It takes away your independence. You can't work, you can't function, you can't take care of yourself. And in my case, that meant I couldn't take care of my husband and my family and my job. And I hated every moment of being on oral steroids. And so it's not steroids, pain medication, I'm sorry. So during that time period, we also tried several different other treatment options. We did lumbar injections. I had a series of 3 of those. Each one had 4 injections in it, so I had actually 12 lumbar injections, and I would only get very minimal relief, maybe 1-2 days at the very most. And my symptoms just continued to increase, and my pain level became just intolerable. And I was fearful of increasing my oral medications. And so after my surgery, my pain specialist and I continued to do these lumbar injections, and we were hoping that I would get some sort of relief, that I could get off the oral medications and get my life back. I was very, very concerned that I was going to lose my job. And more than that, I was concerned about losing myself. I fell into a very deep depression, and that black hole that I talk about, I was in that for months, and I just couldn't function. It was horrible. It was the worst few months of my life after this injury. So my wonderful doctor, who's in Scottsdale, Arizona, Dr. Shapiro, decided that we needed to take some pretty drastic steps so I could get my life back, because nothing else was working. Physical therapy, the injections, nothing. And so the first thing we did was to go into a testing of a stimulator. This is a stimulator that you wear outside your body to see if you can get the pain relief that you need. We did that, we attempted that, and unfortunately for me, that did not work. So the next step was then to try and see a test with an implanted pain pump to see the kinds of relief. Now, these tests generally are done in the hospital, and you have to stay overnight, so you can be monitored to see the kinds of pain relief that you get from these particular units. And so when I was in the second time for the pain pump, I did get pretty substantial relief, a relief that I hadn't felt in months since prior to before the injury. So I had to make a very big decision because it was a life-changing decision. Do I want to go to the next step and have a hockey puck, basically, that's the size of most pain pumps, implanted into my abdomen? That unit then is connected through cords that run from the unit, and the unit it's about this big, I would say. And so the leads then, the wires then are connected from that unit, which is implanted permanently into your abdomen. And then those cords then are run to your spinal cord, and they are permanently affixed to your spinal cord. So the medication can go directly to the source of the major nerve, wherever your injury may be, in this case, in my left leg. And so I made the decision after long conversations with my doctor and my family and my husband and other medical professionals, because you do have to have a psychological evaluation to see if you psychologically can handle what you're about to do. So this was in September. This was in August of 2007. So over a year, I had been struggling with this disease. And so I made the decision. I made the decision that I wanted my life back. And the way for me to get my life back was to have an implanted pain pump. Now, one of the things you have to remember is when you make this decision, this pump has to be refilled. And so depending on your pain level, depending on the amount of medication that you have infused, and depending on your body and how your body adjusts to it, these refills can come anywhere from 3 to 4 months. That's generally the most that doctors like to go out for these. And so you go into the doctor's office and you have whatever remaining medication is left in your pump. And as the time goes by, the medication has less effectiveness. And so that is why, we do that specific time period for pain pump medication. You go into the doctor's office and you have the remaining leftover medication, and then that's removed through a needle, which is inserted in your abdomen, and it goes down to the port in the pain pump itself. There's a little port that has a tiny little hole in it, and then the needle is put into that, and then your new medication is delivered. And then your doctor does a check to make sure the systems are all working correctly. And that happens about every 3 to 4 months. Is it painful? Not really. Is it a little discomfort? Yes, it's a little discomfort. In my particular case, when my pump is refilled, they have to do it with x-rays because mine's pretty deep. And so in order to prevent multiple stabs, if you will, they use an x-ray when they fill my pain pump. But it's not a big deal. It's not very painful. Now, in my particular case, I had my first pump put in 2007. It lasted 5 years. I got a malfunction 5 years in that December. And luckily for me, I didn't actually know that it was malfunctioning. My dog actually heard the alarm that went off in it, and he actually alerted me that I was having a problem. He's done that actually twice, and so he is now a certified service dog for me because he's actually heard that alarm go off, that there was a problem and a malfunction in my unit. So my first implant was in 2007. The second one was in December of 2012. And then my third pump was in 2017. Again, I had a malfunction, and the pump started not working correctly. And that's a pretty precarious situation when that happens. You have to seek medical attention pretty quickly, and they have to either resolve the problem or replace it in a pretty quick turnaround time. In my case, this was 3 to 4 days. Got in touch with my doctor. He checked it. Yes, it wasn't working. So we then immediately scheduled to go in and have it replaced. Now, during these replacements, the wires are not generally replaced unless there's a problem with those. Those have a tendency to last quite a while. I still have the original set of my wires. So today's 21, so they were implanted in 2007. So they've done really well. I am scheduled for my replacement in 2 years. I'm 5 years this year. I'm sorry, 5 years next year, 4 years this December. So I'm hoping I get past that threshold and I can get into year 6 or 7. At the 7-year mark is when they do generally replace these implants. Mine is a Medtronics, and I don't deal with it on an everyday basis. It does its job. It maintains my pain levels. It gives me the opportunity to live a relatively normal life. And so I made the decision because I wanted my life back. I did not want to live on oral opioids. I knew that that was not something that was going to end well, and I just knew that after all my research, I needed to take a pretty drastic step to get my life back. And so that's what I did, and I don't regret it for one single second. Have I had some complications and problems? Yes, but isn't that what we have every day? We have complications and problems every day in our normal life. We just learn to address the problem, make the decision about what needs to be done to correct the problem, and then move forward. Because if you don't, then you're going to allow RSD to take over your life and control it, and frankly, destroy it. Suicide rates in patients with RSD are astronomical, and we have to work together to get ourselves, if you're in that black hole, out of that black hole, and if you're not, to stay out of it. It is a horrible place to be, and it literally is, in my view. I call it a black hole because that's what it's like. You can't see, you can't feel, you can't do anything, you can't get out. And so I choose never to go back to that spot again. Do I have down days? Of course I do. Do I get frustrated? Yes, of course I do. Do I wish that I didn't have this? Absolutely I do. But I've just learned over the course of this journey that I had to come to peace with it, and I just had to learn to let it do its job, because I knew without it I was going to be in a really bad place, and I had too much to live for with my family. Today I've got 3 children and 3 grandchildren, and is it worth the uncomfortableness and the struggles? Absolutely, because I get to see and be a part of their lives, and I wouldn't miss that for the world. So if you are in a place where you are contemplating a stimulator or you are contemplating an implanted pump, if you feel the need to reach out to somebody that has personally experienced these and the lumbar injections, I'm here for you. I mean that very sincerely. I had a good support network, but you know, there's nothing like talking to somebody that's actually living what you're living, because your family, unless they're a patient as well, they don't understand chronic pain. They don't understand the day-to-day struggle. They don't understand the fact that some days you don't want to get out of bed. I understand all of that. And so if my invitation is open, if you feel like you need to speak to somebody, please reach out to me. You can just follow the trail here. You can go to my YouTube channel. You can send me a message through the support group. I sincerely mean that, because as somebody who's been in the worst place in her life and now is in a pretty good place, with some challenges. I'm not going to say that there's not challenges. My biggest struggle physically is that since my beginning on opioids, I've actually put on quite a significant amount of weight. And so I'm struggling with that. My body does not assimilate that as quickly as I would like. I've also had a lot of orthopedic injuries in the process, and so my physical activity is very, very limited, and it's very hard for me. The best thing for me would be a pool, and unfortunately I just don't have a pool at this stage of the game. I'm working on it though. So I really mean what I say when, if you are in a place and you need to speak to somebody, I am here to help you. I mean that honestly and sincerely. And just send me a message, and we'll figure out a way to connect with each other. So make it a great rest of the week, guys. October is next week. Can you believe October is next week? Wow, the year has just flown by. I hope you are well. I hope you've had a great week. I hope you have a wonderful weekend. Get out and enjoy the beautiful fall weather, and God bless, and I will see you in the next video. Take care. Bye-bye.